Okay, the vagina does like to be at a particular pH, right? So let's say about 4.5, and the semen's pH is 7 to 8. So it can really make your vagina more basic. So that's why even premenopausal,
I don't want a basic.
You don't want a basic vagina.
I want a special.
well, acid based, basic. Okay.
I want it to be basic.
My gosh.
I'm Nakia.
I'm Dawn.
And I'm Camila.
We are the Middle-Aged Mamas.
Okay, so does everyone experience perimenopause, or you can just go straight to menopause? And how do you know that it's coming?
That's like saying, can I have a baby and not have any pain?
So everyone does experience it.
No, yeah, everybody's gonna have something.
It's just the
levels.
Like, it's just like, I mean, maybe
yes.
how bad it is,
Yeah.
how, you know. But that's subjective too, right? Like,
Yeah.
I don't know.
And we also asked a question last time: is menopause hereditary? The way you go through it, is it hereditary?
Age, yeah. So I always tell people like, well, when did your mom have it? You know, like, why, you know, but you know, talking to our mothers, like, picking teeth, you know, like they never remember anything. You're like, come on,
If
like
they remember,
when, like what, you know?
Yeah.
So they, you know, I don't know. They don't want to talk about it, so they act like they don't remember. Or if they really don't remember, I don't know which one it is, but
I think it's that generation. They just don't.
Right.
share
They don't.
a lot
Yeah.
of
Exactly. So
information.
you're like,
we're gonna be like blabbermouths saying everything.
yeah. Tell us that.
Right.
Tell them
But
that.
that generation
Yeah.
definitely.
You cannot get out of them.
But because
you
their
do-
moms didn't talk to them. Like,
Right.
that's what my mom said. Like, even when she started her cycle, like she didn't know what was going on. Like, her mom didn't prepare her. And so, you know, and that was just that was a generation. It wasn't like it was bad. That was just
that was just how it
it
Right, no.
was.
Yeah.
But so now my mom tries to you know, tell me, at least when I was a kid, she certainly prepared me for all of those things. But there were things that would happen, and I shared this before too, that she was going through perimenopause. Like, she was having, you know, she had postpartum and perimenopause and all of these things, but no one was talking about it back then. So you just say, oh, she's crazy. And I'm happy that we're away from that, of just calling.
I mean, I think
crazy.
I don't like. Okay, so there's a couple things. Okay, so we're gonna take your uterus out. That's a hysterectomy, right?
Yeah.
Okay, so then they call women hysterical. You see how like they all the words like
It's
come from the same
all-
place.
that comes from
That's where
that.
that comes. Yeah.
Well, it's like Latin roots, right? And so like it came about from kind of all like the root of all the words, right? And so,
we were put in, you know, mental institutions.
Yeah.
And
but in
hysterical
general, we shouldn't call people
because
crazy, right? I do feel like black people have that bad.
Right,
Like,
that's
oh,
what we did.
he's crazy. No, he's not crazy. I mean, you know, he is in like the colloquial way, but this person is not just crazy. Like, no, they have a diagnosis.
Right.
What is the problem? Right? You know, you break up with guys you're dating. Like, no, he's crazy. And okay, he had maybe, but what he has, there's a term to whatever he has,
Absolutely.
right?
Yeah, absolutely.
And
That's
so,
that mental health piece.
Yeah, that everybody
we don't talk about.
Yeah, we don't.
Yes.
But even like working in the healthcare system, I can refer somebody to psychiatry and they still won't let me see the notes. And I'm like, well, you are stigmatizing it too. Because I can see their internal medicine notes, right?
Yeah.
I can see how their blood pressure is going and when the doctor changed the medicine, when the whatever, right? But you're hiding their mental health piece, so you are helping to contribute, right? Because if I'm that person's doctor, I should also be able to see, especially if I sent them there. Well, what happened?
Yeah.
Right? Like, what happened
You
after
need
I
to
sent
know
them there?
the full picture.
Yeah,
That helps.
so you hiding it even within the medical system, to me, is helping to stigmatize mental health, right? And your brain is just, you know, maybe lacking some serotonin, right? And then maybe that's why you're depressed. Like, okay, you have a little something wrong with your angiotensin, so yeah, you have hypertension, right? So why are we hiding something about serotonin, but we're not hiding something about, you know, your blood vessels being able to maintain normal pressure? Like, it's not.
Wow.
I
just feel like we should be more open. We should talk about it. Doctors should be able to see the other doctors' notes. I don't know why we're hiding it. And
as long as you're not changing anything, it's
no, and you can't,
point.
right?
Yeah.
I can't change a note that somebody else logged in and wrote, right?
So see that.
That is very interesting. And so that's the piece where I feel like we don't get all of that good information from our mothers because they weren't talking about it that way. And so when I talk to my mom and she reflects that, She's like, oh yeah, that's probably what was going on. Or no, she recently told me that she started menopause at 50, and that she doesn't recall having any perimenopause symptoms. She didn't have hot flashes and all that, but I'm thinking you had some mood swings, like you had some stuff,
right?
You know, but because people weren't talking about it, even when it started happening for me, I had no idea what was going on. And you know, like how Nakia started off, like we talk about all of these things, even pregnancy. You know, you had that big old fat book about
what to
expect when you're expecting.
Right.
But then after that, there's nothing else.
Nothing.
Like, what about when I get this baby home? I remember I was still in shock when the doctor told me the baby was gonna want to eat like every 2 hours. He said, even when I'm asleep, I said that to the doctor. I was like, even when I'm sleeping, like, you know, so there.
We don't just go to bed.
You gotta wake up.
We just going to sleep.
Or what about that big old diaper that they put you? I had a C-section, and when I came to, I was like, why am I bleeding? I didn't have a vaginal birth. I did not understand that no matter what, you were going to shed all that blood.
Oh.
No one told me. That was the biggest surprise
that
out of everything.
I didn't know that either.
Didn't you wear it?
Yeah, but I didn't have a C-section. Yeah,
I
had that big old diaper.
I didn't recall.
Yes, you had a diaper on because you had to shed the lining. Yeah.
I don't remember that.
Big old diaper.
This is a little nip.
Maybe I blocked it out.
And then that, you know, but it's.
But I didn't understand why I was bleeding because I didn't have a vaginal birth.
Yeah.
Oh,
And no, I mean, some things we just think
That is
expect people would like think, but you know, sometimes you're not thinking that.
Yeah.
There's nothing wrong with it. It's just sometimes we think that you would know like maybe a little more than you do. It's okay, you know,
Right.
we just don't, you know, you have to tell us too. But
Stuff you don't
we
think
actually changed it where, you know, you're gonna, if you're a postpartum visit, you're gonna come at 6 weeks, but now we're doing a 3-week telephone visit because you come so frequently during pregnancy, and then it's like this big drop off, right? And then we don't know, the mom just feels like, so where is everybody now? I'm just home with this baby and everything's just gone, you know, like there's no doctor, you know, and especially at the end, you're going like every week or whatever, right? And then it's just silence, you know, for 6 weeks. And then I was like, the moms, you know, they're coming back, and I mean, the hair disheveled, looking crazy. Like, I had a beautiful patient.
And they probably
and
have
she was like, she can't even
postpartum.
look at them. I can't even look in the mirror at myself. Like, that's how much depressed she is, you know? So I tell people, even when they're, you know, we're discharging them, like, if you feel depressed, I'm trying to tell the husband what it looks like with the, you know, because I was like, imagine it, you know, it's perfectly, well, it's not perfect, but there's little clouds in the sky, but it's no clouds out, it's hot, the sun's out, it's like a nice day, right? And if you were depressed, it would be like foggy, cloudy, and you're like, no, I don't want to go outside, like, it's foggy out there, like, it's sprinkling, like, no, I don't want to go outside, you know? And so that's what depression's like, right? Everybody else is like, what are you talking about? The sun's out. And in your mind, it's foggy and gloomy outside, right? And so, you know, if you're not interested in the baby and the baby's crying and you're telling your husband to go deal with it, and then that's postpartum depression, right? I'm like, there's fatigue. You might spill your orange juice and cry a little bit. Like, oh, that's okay. That's normal because you're tired, right? But if you don't want to do your normal daily activities, tending to the baby, taking a shower, washing your hair, like if you're not doing those things, like that's depression, right? And call us. Right, so now we do a telephone visit at 3 weeks to just make sure, like, hey, are you feeling emotionally supported? Are you?
Yeah, that's so smart.
Yeah.
That's great.
Because even appearance, like you were saying, the patient that didn't want to look at herself. I remember I held so much water, and I don't know if it was from the IV or what, but it was.
I had a lot of
it
water.
was like like those first few days home. I had like duck feet. I was bigger. Like my husband would mention to me that I was bigger when I went home after having the baby.
Well, imagine if it's physiological. I mean, yes, we gave you IV fluids, right? But,
Yeah.
but we should, and like we need to, because I need, like, people are like, well, why do I need an IV? I'm like, no, I need access to your vein, okay, before all the madness begins. Because what if you have a big blood loss? Then your veins are going to collapse. It's going to be harder for me to get that vein if I need to, like, give you fluids to resuscitate you or anything, right? So, like, we need the access in the beginning. But yes, we do give you a lot of fluids, and then something called your oncotic pressure is just a normal physiologic change of pregnancy. And so that pressure gradient really keeps fluids and everything inside your blood vessels nicely. But the oncotic pressure changes, and then they shift. And so that's why you get edematous anyway, just in general, right, in pregnancy. And sometimes it shifts into, like, that wrist, and that's why people get carpal tunnel, you know, in pregnancy. And so then I can imagine now you've had this baby, and now it's not like, I have all this back pain from the epidural. I'm like, no, you have back pain because you've been pregnant for months.
Right.
Yeah,
finally got the weight off.
Drawing on your spine,
Right.
drawing on your spine,
Right.
and then you just boom, it's done, right? It's not like weight loss that's gradual, right?
Right.
It's just like
all of a
boom
sudden.
and then gone.
Yeah.
Right. So now your muscles and everything have to adjust, and and your fluids are trying to shift, and your uterus is trying to go back to normal shape, and your intestines are falling back down to where they should. So you have all this stuff going on, right? Because your uterus stretches by like 500, expands, right, in pregnancy, and so then all of a sudden it's just like it was up here, now it's at your belly button because you had a baby, right? And then it's cramping to continue to go down to like its normal size. So you have all these changes, happening, all at the same time. So I mean. Yeah. It's a lot, and it's upsetting, and you're looking in the mirror, and you don't feel like you look like yourself, and you're tired, and you're not like me. Not like that I would tolerate it better, but I mean, like, I stay up all night, like, all the time, like, delivering babies, doing this, I'm asleep, but then somebody called, and then, right? So, like, maybe I will tolerate it a little bit better, but for the average person, like, something, get up. Get up. Yeah. You're like, what? Right.
Yeah.
So
you're not used to
it, right? And so of course you're like you are like at your wits end. Like, what is happening? Absolutely. What is happening? I mean, you love this little thing, but you are still like, hold on. Yeah. So I get it, but that's why we need to check on you, to make sure.
That's a great thing with the 3-week policy.
Yeah.
It makes me want to go have a baby.
No, thank you. Done and
all this baby talk.
One and done.
But I think what happens is that you forget. Like my first pregnancy, it was hard. I still remember. Like even after delivering, I passed out, and everybody's so like worried about the baby.
Pass out.
I know, but I don't know what was going on. But they took good care of me. But all of those things, even like that first poop, OMG, like nobody talks about that.
I had to have him hold my hand. I was so nervous.
Are you serious?
My God.
Yeah, I was so nervous. When you have a C-section, everything, like William said, he saw my stomach out, and this was over here. Yeah. I had twins, and my second set were big, so I had a 7-9 pound baby, and then 7'4". And I'm 5'4", but he's 6'4", so it's like
it was
the pooping after my stomach was so disheveled and like you have like this weird sloshy feeling. Was
because their intestines, right? Like they all got pushed out the way, and now they're like
back to
normal position.
Yeah, it took a while for everything to settle back down. That's another thing that people don't tell you about. It's just
all of those,
surprise.
All of those things, and then,
like cramping during, the nursing, breastfeeding.
Yes.
So that hurts, and you get cramps, you get bad cramps, then you might get a letdown bleed after, right? So then that bleeding
what's that?
It's bleeding like right behind a feed.
In your boob?
No.
In your I
never heard that.
Well, I was still bleeding, so it's just.
But that's just.
But it can get a little bit heavy. It can pick up just a little bit, because it's contracting during the feeding, the suckling, and then it relaxes a little bit when the feeding is done, and then you might bleed a little bit more, like you might get a little gush,
Yeah.
So we're trying to tell everybody like all this stuff is going to happen.
There's so much. Even the the episiotomy, like when they cut you.
Or you tear, or whatever happens.
Right. I was cut the first time, and the second time I said, no, don't do it. Let me just tear and see.
What? I will tell you. You might not. You just might not tear, but I don't think we should cut episiotomy standardly. We should not.
Yes, because my first pregnancy, I was really, really big, and the doctor was telling me I was going to have this big baby, and so he was already assuming the baby was going to be big and have this big old.
Well, did you have an ultrasound? Yeah. To estimate the fetal weight?
Yeah, I guess. I don't know.
I mean, can we just look at you and be like, oh, you're going to have a big baby?
There was
how big?
When they do the measurements, but sometimes they're off.
Right, but so
by a pound.
Right.
Yeah.
He was off by a lot, and so it was Maya. She came out like this little peanut. But he cut me, and he cut me like my husband, who is a surgeon himself, who was not like grossed out or traumatized by any of this stuff. I just remember looking at his face, like when he cut me, and my husband
Did he pass out?
No, he didn't. But he told me later. He was just like, he
cut
had
you
to
too
do you
far?
like that. He was like, I saw. He was like, all your veins, all your this was like popping out. And he
Wait a
was-
minute, he cut. This is like the skin
Between
right
the
below the
butthole
vagina.
and the.
So there's
the-
different directions we can cut in.
Okay.
But you should really wait until you know you need to cut. You don't just cut because I think it's going to be a big baby. You're supposed to, you should wait till maybe you see bleeding, like a certain kind of like amount of bleeding, because then I'm gonna feel like, okay, she could be tearing somewhere else that I can't see, and that's gonna be more difficult to repair. So tearing up the lateral wall, the side walls of your vagina, that I can't like get in there, right, to do the repair very easily.
Yes.
So if I think that is happening based off the volume of bleeding, yes, I should cut, right? The baby's heart rate's down, but the baby's almost there, right? And I want to expedite delivery.
Right.
I can cut, right? Maternal, like just absolute maternal exhaustion. Sure, I can cut, right? But just like, I think it's a big baby, I'm gonna cut, and the baby's like not kind of stretching like right at that introit is like right getting ready to come out. Like, why would I be cutting before then? Maybe you're gonna tolerate this, right? Like the nurse has already been putting like oil in your vagina and massaging your perineum this whole time. So like maybe you don't need to be cut. So I need other things to be an indicator for why I'm just like cutting. But yes, we can cut up and down, or we can cut more like at the right angle. I tend to not cut necessarily either one, but that's not really a term. It's not a real term, but I actually cut like so not when at 45 degrees or 90, right? I don't cut up, I don't cut straight up and down, and I don't cut that way. I cut like just off to the side a little bit.
Oh, you have a little signature.
Yeah,
Signature move.
Dr. Toni.
A little signature.
but it gives me space, so if I think it's a big baby, then I can do certain manipulations, right? Because you have something called a wood screw, so we kind of like turn just a little bit if we think the shoulders are stuck behind the mom's pubic bone. So then we have to do certain maneuvers. So you do want a little bit of space, but I don't know that we should be standardly cutting, in a episiotomy. But with that said, it is, if I tore a piece of paper and told you to tape it back together, or if I cut it with a scissor and told you to tape it back together, you'd be able to tape together better the one you cut than the one you just ripped, right? So I would not be like, don't cut me. Let's say you had a bad tear. Let's say you had a bad tear. Let's say you had a bad tear the first time without a cut. Then you wrote, and then we wanted to cut. I wouldn't say, don't tell them not to cut, right? Because we've already had, like a bad tear, a 3rd-degree tear. We don't want permanent damage of your sphincter muscles, that kind of thing. Right. But in general, you can get like crazy, like things shaped like M's and all over the place, So sometimes cutting just makes a controlled setting. But again, you have to just judge it off of what's happening in that moment.
That's very fascinating. Well, we're all past that point.
We're past that point.
We're all past that point. So now we're all experiencing heavy periods in our 40s. And why is that? Because I started off very slow. I had very abnormal periods when I was a child. It would be 2 months and I would get a period. After childbirth, it's been regular every 28 days or whatever. But it increasingly gets heavier and heavier. And as we have this conversation, we all have that in common.
Yeah.
Why?
Have you had an ultrasound? You have a fibroid?
Oh.
Yeah, I have fibroids and I have ovarian cysts.
So the cyst is not going to make you necessarily have a heavy period, really. It's the fibroid.
But do they naturally get heavier as you
I
get
thought
older?
that. I thought
like
that
the
was like
grand finale we were calling it.
Yeah, as you get closer to menopause.
Right, it's a little 1-2 punch. No.
Yeah.
That's what I was thinking.
No.
So
So
it should
a
be
lot of
more.
times there's something there, right?
So we should check for
But
fibroids.
sometimes it can just be, people will say like, it's just crazy heavy, and it's not necessarily any anatomic reason that we can find for it, but often there is. Maybe there's a polyp inside the lining that we can remove. There's fibroids, and then fibroids, of course, are going to depend on what. Having fibroids in general can cause heavy periods, but it's more of a thing of like what layer of the uterus they're in, right? And that dictates how we can remove it as well.
Okay.
So if one is just not that big, they'll still cause crazy periods, but because it's all the way inside the lining of your uterus, then I can go through your vagina and then through your cervix with a camera and shave it off.
Okay.
Right. But the fibroid needs to be, what we like to say is at least 50% in your cavity for it to be worth
taking it out.
Taking it out from that direction.
And those are hereditary as well, right? Because my sister
Yeah.
had them and my mom. So it will.
It's very common, right?
Okay.
But I would say like Black and Asian women have them a little bit larger, more often.
Okay.
than
And that's
our
something
white
that I go
counterparts.
in and ask them to check for fibroids.
An ultrasound, yeah. We should
Okay.
do an
So
ultrasound.
she's just gonna do that just on a regular like pap smear time because she's noticing that her periods are heavy. So can we just check to make sure that everything is copacetic?
We're supposed
there?
to. Or we're supposed to ask how your periods are going. Right. I'm not supposed to just be like, oh, how you here for your pap? Okay, sit down.
Well, that's usually
And that's
how
it.
it goes.
And you don't say nothing else.
And
But
well,
how would we
maybe
know
you
unless
don't-
someone told us to ask about that? Or
Well,
you had any
I'm saying
knowledge
like
to it?
I should ask you.
Yeah,
Oh,
but if
okay.
you
How
don't
your
get
period-
that, you know.
But if you don't get it, then you should say it. But
Okay, so at pap smear time, or just even now, I can go in and say, can you give me an ultrasound to check for fibroids since my periods are heavy now?
we'll just tell her your periods are heavy. She should know. She
She
or
should
he
know that.
should know that they
Okay.
gotta
Know
do
what
an
to do,
ultrasound.
right?
Yeah,
Okay.
to evaluate it, right? Because then we should
Okay.
go down a longer road. Like they're heavier. How long have they been heavier? Was it just like once? Okay, let's just observe, right? But if this has been like 6 or 7 months, then I need to be like, well, okay, but I'm gonna get some blood work on you too because are you anemic?
Yeah.
Like, is the heaviness of the menses causing you to
Affecting
be
anything
anemic,
else,
right?
right.
Like, because then you're getting headaches and you're getting fatigue, right? And depending on how heavy your bleeding is, and how anemic you are, like I don't want you in your 40s, late 40s, you know, and maybe also have a history of hypertension to have a heart attack, right? Because you just don't have enough blood going through the vessels per relax and contract of the heart, right?
Right.
So because your volume's not there,
Right.
so I
You
need
don't
to
wanna
be
be too
thinking like
anemic.
I need to be far ahead of you for what you're saying in my
Right.
like medical mind,
Right. So your period should remain relatively the same throughout all of your periods, you know, your flow.
Your flow, yeah, relatively. I mean, I'm not saying like you can't have like, I don't know, it was crazy.
One
Like,
heavy
sure,
day.
you know,
Yeah.
but I mean,
Right.
but if it's just consistently heavier and it was never like that,
Right.
let me do an ultrasound. Let me see if something's there.
Okay.
And that's flow, right? That's not regularity of it. That is regularity now is like, no, they're still regular, but I keep bleeding and spotting in between.
Okay.
Right. That could also tell me fibroid. That
Something
could also
is
tell me maybe something's going on in the lining of your uterus, right?
Okay.
So I need to do I need to sit down and do an endometrial biopsy.
That's very helpful.
Just the body is so complicated. You know what I'm saying? It's like
Yeah.
one thing and then another thing because something counteracts the other thing.
Right.
You just never fully know. Well, because we're not doctors and we're not trained. So that's why you're here.
But if you have menopause before 40, right, then we're calling it premature menopause.
Okay.
Versus somebody at 41 or 42, we're like, oh, it's just early, right? But it's not premature, right? Before 40 years old, we're going to call it what we call POF. And so that's premature ovarian failure,
Oh.
which just sounds aggressive. People don't.
Yeah.
Right. So like ovarian failure, but you don't actually need your ovaries
It sounds.
unless
For
you want
the
to have
period.
children. You can get rid of your ovaries, right?
Certainly you could, but why would we do that? There's
But I'm
no-
saying the failure. When you say failure, you can still keep your ovaries,
But then
and it's
you
not
can
working.
keep them.
Right?
They're just not producing the estrogen that you need. You know, they're not producing the hormones at the level that you need to maintain your reproductive cycle.
But you can keep
But you
everything
can
intact.
keep them. I mean,
Okay.
certainly, right? Like old ladies still have their ovaries.
but if you get rid of your ovaries, though, I heard that throws you right into menopause, right?
Oh, absolutely. That's why we
Okay.
wouldn't do it. Yeah,
Okay.
that we would not do that. Like even if you're having a hysterectomy, let's say, for something else, we would not take your ovaries before 65 years old because we can decrease your lifespan by about 10 years.
Wow.
Are you
Yeah.
kidding?
Yeah. So there's benefits to your ovaries, regard, you know, because just because you're not producing a lot of estrogen doesn't mean you're producing none, right? You're just not maintaining normal menstrual cycles. So it's not like, I mean, you should keep.
So your ovaries
You
will
keep your
increase
ovaries.
your lifespan by 10 years if you can
Yeah.
keep.
So
if
that's
you
why
can keep
after
them.
menopause, our risk for a heart attack goes up a little bit more, right? And it gets a little bit closer to a man's risk after 40 for a heart attack.
Oh, because the estrogen is keeping everything.
Cardioprotective.
Oh, that's interesting. Oh. So how do you check your estrogen levels? That's just part
You
of your
shouldn't.
regular
You shouldn't.
checkups?
You
Oh, you
shouldn't.
don't?
No.
Oh, okay. Just
I mean, I'm going to check them if, you know, periods are acting weird and, you know, or a reproductive doctor might do it. A reproductive endocrine doctor for fertility reasons.
Okay. Oh, right.
I
went through that.
Might get your estrogen levels or something like that. But the range is very wide. So people come all the time like, I need my hormones checked. I'm like, no.
Right.
You don't.
Because they're on the internet.
And people just tell you stuff, but you have to be careful what internet site you're on.
Right.
You know?
Oh, yeah. So I stay away from it.
Yeah.
Because we're all like,
You're diagnosing yourself.
Yeah. I mean, it could be 30 and it could be 200. Still normal, right?
Oh, okay.
So we just, depends on where you are in your cycle, and varies so much that it's not useful. It's not clinically, it's not useful unless I'm looking at something very, very in particular.
Okay. Okay. So then also, now that we're in our middle age, what type of testing needs to be done on a regular basis?
Nothing. Per se.
Oh, so as far as our mammograms, we're told to get that done.
Like that's what you mean. That's something outside like lab work, or what do you mean?
Right, but some people, some insurances
1 to 2 years
will say, don't start until you're 40. Some will say 45. What is the standard?
I think they moved the age up a little bit too.
Yeah, just go through those type of tests.
One is like, what does kind of like ACOG, American, Congress for OBGYN, like what do they support versus what does the U.S. Preventative Task Force say? What does the American Breast Cancer Society say, right? So you actually can find numbers all over the place. So generally speaking, I just tell people, like, please at least have one, between 40 and 45. I think is reasonable.
And then annually after your first?
Annually after your first mammogram? No. But by 45, then we need to be doing them more regularly. Okay. But it could be it's like 1 to 2 years. Yeah. You could do it in 2 years. So it's 1 to 2 years. Okay. Yeah. Because I just do everything once a year because I think that's what you're supposed to do. Either it's okay to do it every year, but it's okay to do it every 2 as well.
And then if they see something, like for myself, I think I had like a little, like, I don't know what it is, but just a little dot in there. It was not cancer, it wasn't anything, but they'll like monitor it.
Yes. So sometimes they'll say 6 months, or they might say, well, we did this mammogram, we saw something, so then did an ultrasound, like immediately, right? And then they let the radiologist read it, and maybe the radiologist says, like, I want her to go to a breast surgeon and I want to aspirate that cyst. I think it's a cyst, but maybe they should aspirate it. Or it looks like a benign cyst, but watch it in 6 months. Right? Okay. So that's how they would kind of like manage a mammogram or seeing something. Okay. On mammogram. So mammogram every 1 to 2 years. Is reasonable. And then what type of mammogram? Because I know they have the different 3D regular. Well, I think really it's just a management of just like screening mammogram or diagnostic mammogram. Okay. Right? So diagnostic mammogram is going to take more images of it because I felt something. Oh, okay. So I'm not sending you for a screening mammogram at that point. It's like I felt a mass and I need you to look at that. So I need you to do a diagnostic mammogram. You need to look at that at more angles. Okay. And we're still with the check around with your hands. Once, like after, but just not around your period. Like after, I would say, like
you said, not around your period.
Yeah, because you might have more long-term hormonal changes, right? So I would want you to do it like maybe a week after your period's gone. Okay. Yeah. And then what else? That's mammogram. Your PAPs, right? We know PAPs are like every 5 years now. So it's really? That's the thing. Everything always moves and shifts. So it is 5 years because that's what my doctors would tell me. Think it was? But I always go annually. I remember they used to say we said every year, and then so now it is after. So now we have the HPV vaccine, right? And so we're vaccinating our kind of like pediatric population. So we used to do PAPs at 18. Now we know to do them at 21 because we're like, give everybody a chance to get exposed to HPV and clear it out, right? Wait, so now it's PAPs at 21? That's so my daughter would wait. She would wait.
When did we get it when we were younger?
18.
Like at 14?
18.
Yeah. So now it's 21.
Can you imagine? No, not at 14. No. Yeah, she was like, my vagina. No, you weren't. No, you were not.
Right. We just now started talking about it to get her ready because she's going to take a while to be okay with that. Right. So, 21 for PAPs. And then what we do is taking notes.
we don't even test for HPV. We're actually just looking at the cells when we do the Pap smear up to 25, and then from 25 to 29 we are looking at the cells, but we are also have the ability to then look back. So if the cells are then abnormal, then we look back to see is HPV present, right? Okay. And then after 30 we're doing basically HPV testing. Do you have HPV or not?
So when we get our pap smear, isn't HPV a part of that? Aren't they looking
That's what I'm
for
saying.
that?
So it's a matter of, are we triaging it? Like, are we going to run it after we see abnormal cells? Right, we're not running it at all between 21 and 25 because we just assume people are getting exposed to it and let them clear it, right? So we just want to know, are the cells abnormal? And then 25 to 29, we're going to really run the HPV try to run it for typing because there's all these different strains. But of the high-risk strains, we're really most concerned about 16 and 18. So we want to know if the cells are abnormal. Are one of these present?
So when you say clear, that means it's going away?
That is unclear.
HPV?
That's what they say on the commercials.
What
That in most cases it clears on its own, but there are
away.
cases that can lead to. That's the
cervical cancer, right? So, but it's but do we really clear it? Is shoddy. We're not sure.
Okay.
It's like,
yeah.
or do you suppress
go
it?
away.
Right? Like just your body just, I've seen this, I'm done with it, right?
Right.
Or can it like come back? We don't think so. We think when you clear it, it's cleared, and maybe there's been a re-exposure of a different strain from a new partner, right? It's also possible. So we're we don't 100%.
So there's the research.
Answers.
We're still doing research on HPV then, pretty much. I mean, we're always still doing research on stuff, right?
We're always still doing research on stuff. I don't know like how much research is HPV related, but yes, right? Because we can always try to figure out maybe a better way.
Yeah.
Right, a more optimal way. That's why we knew to take PAPs and be like, wait a minute, we're being too aggressive with people. Let's move the PAPs out to 21.
Okay, so
18.
21 and then now 5 years. So if you were exposed to HPV and you had like your cells removed and that top layer removed.
By the way, the vaccine is approved up to like 45, 47 years old. So if you
so then should we be getting vaccinated?
go get your vaccine for HPV.
Wait a minute.
I'm already 50. I don't need
Well, but why would be the reason now to get vaccinated for HPV?
Anything
People who
can
are
happen.
People who are single are still dating people. I would say.
I'm still out in these streets, but I'm not having sex.
But it's the same.
But you don't know
But
if you
I'm-
have a new partner,
That's
then
true.
maybe
It's the same thing that
partner
applies to
HPV.
the kids. The same type of thing, getting exposed and having it, and then your cells change. It's the same thing, just in an older woman, right?
Yes,
Because it seems like it's always pushed for the kids.
the
not
vaccine or the
vaccine for HPV.
well, that's
Right.
what it was approved for because originally that's what they studied.
Okay, so now it's approved.
now
for
it's
But
older
now they
folks.
just opened it up. Yeah,
Okay.
they opened it up.
Okay,
Yeah.
I didn't know
Okay.
that.
Okay, so back to my question. So if you have had HPV earlier, and then you take off that top layer of cells,
Like a leap.
I guess that's what it was. I'm talking about myself.
I understand,
So,
but I'm saying you're talking about a leap.
I think it was a
procedure?
leap. It's when they take off
They
that
gave you
top
lidocaine
layer.
and
LEAP, is that what you're saying?
I think when she said it,
LEAP.
it's reminding me that
Yeah,
was the word.
but you got like we gave you a little anesthesia, local anesthesia, and
No, they didn't give me.
so
it
you
was
had a
very-
colposcopy.
They just
You had a
scraped the
colposcopy.
insides?
She didn't take off. I think
No,
you had a
it was.
colposcopy.
She described it as taking off the top layer of like the
Your
frosting
uterus?
because the cells were changing. So she wanted to remove all of that top layer.
It sounds like a leap, but you should have gotten anesthesia for that, and not just nobody could possibly do a leap on you without giving you
It sounded
lidocaine.
like
Didn't
a
you
leap,
say it
but
was
I don't know.
painful?
It was painful, but regardless. So once that was done and everything, your pap smears go back to normal. You just continue on normally getting your every 5 year. It
Yeah.
doesn't, because in the beginning they had me going like every 6 months or whatever, but that was 20 years ago.
Yeah.
So just
We
stick
did
with
do it
it
every 6
every
months
5 years.
Well,
because
I would say yearly for 2 years.
Yeah.
Like let's have 2 normal paps, and then let's.
then after
see what's
that, go
happening.
ahead and
Yeah.
go along with the 5 year plan like they're suggesting.
Yeah.
Okay, cool.
Yeah.
That's good.
All right, menopause. What else? So we talked about Perry.
Yeah,
So
so I keep getting excited whenever I do some
It's a
She's
party.
ready to be
thinking
done.
that it's coming. But I'm wondering, I think I'm probably
well, people are excited for it, I think, but I tell them, well, don't be excited.
okay,
for
so
this.
that's what I want to know, because right now I'm experiencing the heavy periods, which are probably related to my other stuff, but I'm experiencing the mood swings, the hot flashes, the night sweats. So in my mind, I'm thinking once my period stops, like once I'm in menopause.
Oh, you think all the
that's
other
all-
stuff is gonna stop?
Uh-huh,
No.
You're gonna be back to normal?
So
No.
now we don't have to have a pity party.
Snap, crackle, pop. No.
And like the menopausal weight gain, like all of that stuff. I'm excited to not bleed anymore because
Of course.
I'm over that.
But you could have a hysterectomy for that.
Yes.
I mean, you could. You don't have to be that aggressive, but you could.
But so I'm getting excited for nothing other than to lose a period. Like all that stuff is going to continue.
Yeah, maybe. Mm-hmm.
Oh my.
Yeah, my
like
mom just
forever.
told me that.
You know, all bets are off. I can't take
Forever, just like I have to wake up.
Not
in the
necessarily.
middle of the feet to
It's gonna be
baby.
forever.
Not necessarily like forever.
That's funny.
But some
Yeah.
people have some people like have hot flashes for like 10 years. Some people are in their 70s and they're still like
Yeah, my mother.
nighttime and
Really?
My mother
we
does
just
sweat
went
profusely. My mother sweats, and my mother's 75, 4, and she sweats. But she's had a hysterectomy though.
right, because this is like a hormonal thing and not like a bleeding thing.
So it's the hormones that we gonna have to deal with.
Yeah, so it's not the bleed. It's not your
We all
uterus.
just need to go to medical school.
But then at
It's not your bleeding that's causing this problem. It's
At
the
that-
hormones.
Then,
Oh.
then at that point, once you're in menopause, then can you start like a hormonal treatment thingy?
Right.
That's gonna stop all that nonsense.
I mean, is it worth it? I mean,
okay, so
You can't take it out on Tony.
Why is it gonna keep happening?
you thought you were gonna be done.
I'm sorry.
I think that's a general thought though, that after menopause you're good, like you're back to
Good to go.
normal somewhat.
Because
We're here to expel
No,
the myth.
because then it's like vaginal dryness.
And see, Tina talked about
I
that.
heard about
My
that.
sister,
I heard
her
about
doctor
that.
prescribed her a prescription for the vaginal dryness, but she didn't know. He said he could see it coming. And she's like,
I want to know what it looks like inside when vaginal dryness is happening.
It's like,
Okay, so normally your vagina has what we call rugae. It has rugae,
What is
what's
that?
that? I have a lot of that.
like folds.
You don't know what it is. What it is? What
But it's how it looks like. It's not like just this smooth surface like the table.
Yeah.
You have a lot of rugae.
She don't know what it is.
Because it sounds like
cheese.
Like juicy.
It sounds like a good thing.
It
So
does
I'm
I have that. From a tub.
But
So get some
it's more like
Come get some of this rugae.
That is the juicy part, right?
No, it's just a dry part.
no, it's just how it looks. It's just like little folds and but it gets more
Heels and
like
valleys.
this. Yeah, but it gets more like this. That's what makes it dry.
Oh, so
It
it's gonna
loses that
level
right,
out.
Oh,
like,
it loses the.
It loses all of and then
So
it
wait
gets
a
more
minute.
like paper thin.
Let me
it
ask
gets
you
more
this.
Oh my goodness.
This is what makes the inside
The
of it
good stuff?
good. Yes.
All the hills and
I don't know
during
there's a direct
intercourse?
correlation. No, I don't think
During
there's a direct
intercourse?
correlation. That's just how it looks.
Oh, okay. I'm just asking.
And so, but once it gets more flat and kind of like thin, because there's not a lot of estrogen left, like that's what makes intercourse
so
painful to the female.
the
That's
vaginal
what makes it painful?
floor is thin.
Oh.
Is that what's
Okay, the
thin?
whole thing is your vagina. The whole tubular part is your vagina. The outside is your labia. So that's another thing. People come in talking about their vagina, and I'm like, your vagina or your labia?
Right.
They don't
Right.
know the difference.
And they're
The
like
lips.
I know what
looking at
labia
you, right? And they're like,
Right.
okay, the lips. I'm like, okay, your labia.
Yeah.
So there's that, but there's but ends as a whole tubular thing is your vagina,
Right.
and so it can get more dry as a whole.
And will it ever go back to? It'll
Right,
just be
that's
So
dry
so
forever?
intercourse is less likely to be painful if you continue to have intercourse, but if you're not having intercourse,
Oh, so you have to always do it then.
you're not gonna like.
Are you talking about me? That's horrible.
So it can be painful for the woman, but is it also going to be less pleasurable for the man going into your thin little flat tunnel?
Well, let's just talk about whether or not we care.
Oh, I do care.
Well, you want when it comes to you versus in pain versus his pleasure, right?
I don't want any of it.
No, none of us want any of it, of course,
I don't want to be
but
in pain, and it's not good for him either. I'd be like, what we doing? Like,
Not the good way.
I'm over here hurting, and he's like, it don't feel good anyway. So, I don't want that.
I mean, I don't know. I've never asked the guy.
I don't want that to happen.
Feel,
I want to be like.
I just want the female to be comfortable.
Yes.
But you can't. That's what we're saying, right? Like you're married, so you still should just have regular intercourse, and then you're less likely to necessarily have like all of those symptoms.
So what's
and
regular?
It's not going to just like cut in because you're 50. I'm saying it's like this gradual kind of a thing.
So regular, like
helpful.
once a week, twice a week, just to maintain your juices.
Really?
I'm asking. That's a question.
Oh, okay.
I don't know about like
She's like, really? Like, do I?
Your vagina is like a self.
I'm saying that's not a lot. I'm not saying I don't want to have sex. I love having sex.
Okay.
Yeah.
Your vagina is like a self-cleaning, nice organism, okay? But it is dependent on estrogen. It's like estrogen makes it produce like good bacteria, right? To keep a normal, nice homeostasis. So people do. So you don't have to. That's what we tell people. Like you don't need to be douching. You don't need to try to put a washcloth all the way in your vagina. Just like clean your vagina the normal way. You don't have to like
water, right?
Inside of it.
Just water, right?
There's you can do soap. I mean, on the outside of your vagina, like
the outside, not like.
But inside, you're not doing. Well, how
not soap,
not
soap though, right? You don't.
How would you get soap?
How would you get soap inside anyway?
Would you put a little bar soap inside?
Heck no, no.
Because
I'm talking. I guess I'm talking about the labia part.
Yeah,
I guess I'm talking about the labia part.
The labia
You
in
don't
its
need
entirety.
to put soap or anything like that in there, right? When I was younger, before I knew better, I used to wash myself like that. But it used to make me have yeast infections. So of course,
wash yourself with soap? You're supposed to wash yourself with soap.
No, in my vagina.
Oh, inside.
You going in the tunnel with the soap?
Not up in the tunnel. Just. Oh my gosh, how can I explain it?
We want to know. We're trying to just.
I guess the soap was like irritating, and I guess I would maybe
change the soap.
on the labia or whatever.
It was a type of soap, probably.
Yeah, maybe.
It was
but I don't even. I just wash it really good with water.
No, I mean I use soap,
traumatized.
but
traumatized.
Well, and you clearly haven't started sweating yet.
Not down there, not like that.
Well, it's
really. No.
Since you fanning right now.
It's the rooter to the tutor. It is.
Oh no.
It's everywhere.
So okay, let's talk. What about hormone replacement? Does that do anything? Is that a thing for women?
So
to not have to go
with
through
like
all of
not
this.
like a whole lot of other medical problems and relatively normal BMI, not a smoker, and you can take birth control pills even up to 55 years old.
Okay.
Oh.
Low dose, right? And that just makes it's gonna regulate your period, right? So you don't have to worry about those.
Will it make it come back if it's like how Dawn is saying she has 6 months here, 6 months?
I don't have 6 months here and there. I just have a month.
Oh, okay.
Right, but so I'm saying it'll regulate it, so you don't, because what happens is that it starts getting irregular, right?
And it just comes on.
And then people be like, "Oh my God!"
nowhere.
The floodgates just opened. I was
Yeah.
in Trader Joe's. I had to leave.
Yeah.
You know what I mean? Because you don't
That's
know.
what
It's from like the imbalance, right? And you don't know. Yeah.
Okay.
Yeah.
And so you're saying a birth
Some people
control
like afraid to
low
leave the
dose.
house without tampons. You know?
Yeah. I keep
because you don't know when it's
change
gonna.
your panties, all that. Yeah.
So a low dose birth control, you said, will help that.
Yeah.
Okay. And that's considered a hormone replacement.
No, it's not considered. Just consider birth control, but you can take it up to 55 years old. So I say that to like
help that
to spread out the timing, right, of all the madness, right? Because then HRT, basically, because of the timing that it was studied, it's even lower dose than birth control pills, but it was studied only for 5 years. Okay, so then we talk about, well, what study was that? So that was like the big Women's Health Initiative study. It's the study we have. It's not.
Yes,
The
it's
best
not the
study.
greatest, right?
It's not the best study because of the candidates they had in it. They had people like over 60, many over 65 using it. They had people were obese. They were smokers. They were.
Well, why
so
wouldn't
then,
they just do
so
it
we had to
over?
stop the study. Well, yeah, we could say that, but we had to stop the study, right? Because people were having heart attacks, and so. But they weren't good candidates to begin with, right?
Right.
Because they were older and fat and smoking. So
Old, fat, and smoking.
So we know now, right? Yes, you can take birth control up to 55 years old. We have proven that, right, to be like safe. Okay. And then the dose, decreases significantly, and then I can actually transition you over to like HRT, right?
After 55.
Yeah. Well, you can do it before 55, but I'm just saying that's how I kind of try to stretch out a little bit, like people kind of being able to take it, because based off the timing that the study was then stopped. Was 5 years. So when you have a uterus, you have to take estrogen and progesterone, because estrogen alone, which is really your thermoregulatory hormone, so that's what's causing your hot flash problem. You can't take that alone when you have a uterus, because it'll give you endometrial cancer.
Oh my goodness.
So you have to take the progesterone at least, if you're going to take it orally, at least 2 weeks out of every month. Some people just go ahead and take it daily for the sake of memory. Or I could just put a Mirena IUD in, right? I could put a progesterone IUD in your uterus, and then that will give me the uterine protection. And then you could just use like a Climera patch, like an estrogen patch, and you just change it weekly. So that can help, right, with hot flashes, and that is considered like HRT. But if you don't have a uterus, then you don't need the progesterone. So why, like, my personal preference is to use a progesterone IUD is because the oral progesterone was the arm of the study that slightly increased the risk for breast cancer. So if I'm not giving you the progesterone orally, then I'm bringing that risk down. Okay. Yeah.
So this is the implant one that you're talking about.
The intrauterine device.
Okay. So fascinating. So we have a question from our Facebook group. Someone wanted to know how to.
Oh, are we live?
No, we're not. We're not live right now. Someone wrote in.
I didn't know if somebody was like writing it down.
No.
Okay. We put the question
coming soon though, but we put the question on in advance.
Okay.
Someone wanted to know a natural remedy for hot flashes, if there is such a thing.
I don't necessarily have one. Okay. But soy is thought to be like a natural kind of estrogen similar thing. So that's why I actually tell people, I'm like, why are you eating all this tofu? Premenopausal. I don't know. I don't know the effects of it, but tofu is like soy based, right? And so soy is like estrogen like.
Oh, okay.
There was one of my colleagues saw a patient, and she's like, it was an older black lady, and she kept saying she was using Crisco.
To do what?
On her like labia, and like around and kept saying it was helping her for dryness. She kept thinking, well, why is she be using Crisco? Like, why is she using Crisco? And so she said when she went to the store, she was like, let me see what is even in this, because she keeps saying how it works good.
Crisco.
It is soy based.
Oh.
It's soy based.
But it smells like fried chicken.
It smells like what? Like fried chicken. Don't smell like fried chicken unless you fried chicken in it.
It makes her more enticing.
Would you recommend?
Why don't you get some lube? You can get lube from the Dollar Tree.
Because that's not
Well, lube that might have some alcohol or something in it, right?
Lubrication was going to be ultimately has alcohol in it. It is going to be very drying and make it worse. You actually should not be using.
So
don't buy it at the dollar store, even if it is the right thing.
Like on your labia as a prophylaxis, as an estrogen replacement. I'm not talking about dryness in the moment of intercourse. Like that's fine. But I'm talking about a treatment for like the skin of the labia and everything getting very dry. Because what happens with menopause is that the labia minora and the labia majora actually start to shrink a little bit, and they start to fuse together. There's two.
What?
There's two.
Does that make you tighter?
That's not vaginal rejuvenation.
That makes you dry and painful with insertion.
Get ready.
That's
it's gonna be dry. It's gonna be tight.
Oh my God!
Don't rip it. Because now you be back to the episiotomy.
Oh my God! Wait a minute. So you said they fuse together after a certain amount of time?
Not like closing your vagina. I'm talking about your labia minora majora. Yeah, they can start to fuse where you can't really pull
I need the diagram. I don't know what that is.
God. It's the inside and the outside, or is it the
inside lips and the outside lips?
Yeah. Oh, okay.
Inside.
Right.
Yes, girl.
I'm like a 14-year-old.
Go home and check it
Wow.
out.
Go home and check it out, right?
Inside
So she
and
was
outside.
using the Crisco as just
the
a
hairy
treatment.
part.
It
Not
wasn't,
the hairy
she
part.
wasn't using it for lube.
No, she was not using it for lubrication.
Oh,
She was using it to
she was
just treat
just dry.
She was
vaginal.
using
Yeah.
like lotion.
And so
Yeah.
I guess maybe I don't know. Maybe she could just feel she was just uncomfortable. Period.
Yeah, but I had some patients. I told them like, try it because it's cheaper than estrase cream. Can be $100 for your estrogen cream. Can be $100 for that little
so
tube.
that's what you have to use is estrogen.
Estrogen cream, yes.
Oh, that's
which
probably
is
what she got the prescription for.
Yeah.
Tina.
yeah.
Oh.
Yeah.
Yeah.
But it could be
So
$100
you're saying
Really?
Crisco
Yeah.
is okay to use?
on the outside, not
soy
inside.
based.
I ain't using no damn
So that's what
Crisco.
people are asking about, like
So funny.
like a natural remedy.
Yeah.
That's all I got for you.
I mean, it's oil.
gotta be a black person that
Just-
came with
I know,
that too.
somebody's grandma said, "Girl, you better just put some Crisco on
Yeah.
there, baby." Come on now. What?
But it's soy based, and soy is like a
She said an estrogen replacement, right?
It's not estrogen replacement, but ish. Let's
Yeah.
just say.
So I want to go back
gosh.
to. So you're saying once this starts, this dryness happens, lube is not the way to go.
She said yes for sexual
Oh, for
purposes.
sex.
I mean, maybe
Not
just
for-
in that moment, but it still may not help all the way because really what's happening is
It wears off.
okay, it wears off, but you don't have you haven't lost like the normal natural folds, right? Imagine the whole vagina being like paper thin. Okay, so that little lubrication for that time, just a maybe an initiation that you need
But it's not
you
gonna
need to get
sustain.
but it's not going to sustain the whole time of intercourse, right? Whereas you don't need it to necessarily
I can't
when you're
believe
younger.
you right now. She is going crazy.
What about what about like foreplay, like some good saliva? That's not
No, I heard. Wait, what was I watching?
like
Saliva's not.
They were saying because the bacteria will throw off your pH
that
balance.
mouth?
What was I watching?
So your
I was
okay,
watching
the
something.
vagina does like to be at a particular pH, right? So let's say about 4.5, and the semen's pH is 7 to 8. So it can really make your vagina more basic. So that's why even
Basic?
premenopausal,
I don't want a basic.
You don't want a
vagina.
basic vagina.
I want a special one.
well, acid based, basic. Okay.
I don't want it to be basic.
Oh my gosh, you guys are so
So, but you're saying like saliva is not. Are we saying no on the saliva?
No on the saliva, but I'm
It
also
throws
talking
off
about
your pH balance to
why
make it smell.
semen can give you BV, right?
BV?
Bacterial vaginosis.
Oh, because
okay.
the pH is just
I
so
never had
different.
that.
Yeah.
Really?
I have. Whoa. Horrible. And it stinks.
It's horrid. But
Yes.
in menopause, people start getting recurrent bacterial vaginosis because the pH is off because you don't have your estrogen.
Wait, that's the stinky one too?
They don't
Oh
stink.
God.
That's the one that smells.
Wait, what
Just
doesn't
BV.
smell?
A yeast.
BV stinks.
Yeast infection
That
does not
means it's
smell.
your bacteria is
just
off,
itches.
right?
Yeah.
What else can throw off your bacteria?
I mean, that's like
certain foods make it smell
Nanoxol
good.
9. No, it's not like a diet thing, but Nanoxol 9, right? The spermicide
Okay.
can.
So pineapple juice, that's
the
not
spermicide
real?
that's in condoms.
What's the
Pineapple juice is real though. Don't you have a more
Pineapple juice
pleasant
is real.
when you drink pineapple juice and it comes through
about
your
the Kardashians? There was that episode. On the
They were
Kardashians
drinking pineapple
where
juice?
they were drinking all this pineapple juice
That's
to
like
make their
that.
Make the
vagina
vagina-
taste good.
That's not true.
What about your? Let's talk about anatomy. Coming through where? The pineapple juice don't come out your
No,
vagina.
because sometimes your pee smells better when you drink a lot of water, or the
It
asparagus.
smells-
You
Water
have that
comes
pee
to your
smell.
body, though.
So it's mainly
I
your
guess so,
pee
kind of.
though. It's affecting.
Right. So it's
Okay.
your. I mean, I don't know that drinking pineapple juice is gonna make your pee smell better. I don't know. But what I'm saying is, but your
You never heard that?
no, but your pee.
I have heard that.
It's gonna make your vagina taste good. Is what I.
I've heard all of that.
How did it
I've
get
heard
to
all
your
of that.
vagina?
I don't know,
There
but
is
I've heard
a
all of
song
that. I've heard all of
says
that.
She eats talking about pineapple. Eating
I've heard
pineapple.
all of that.
She
Speaking
tastes
of
like
that,
pineapple.
what about all this crazy craze? This is not my thing, but the crazy craze of eating booties.
What?
Of people
it's
eating
just-
booties, like
What?
It's gross. It's not sanitary.
that's not kosher, right? You should not be eating booties. You, Don, I know you've heard this before.
I do know what you.
Why are you shocked? Why are you touching your bro?
So maybe the question should be.
I want the doctor to clear it up that that's not good to do.
Well, of course it's not.
No, it's not.
But it's a craze right now.
What if you just want to be freaky deaky? You're not thinking about this is not good for me.
Oral sex. Maybe that's the question.
No, I'm talking about the butt. Like licking around the butt. That is
I would
not.
say no.
Yeah. The bacteria and all that stuff, right?
What will it do? What will it do? Let me stop.
I mean, I don't know exactly what it would do.
I
I'm
heard
not a
you
GI
can get
doctor, but I would imagine that you should not have all that E. coli in your
Yeah,
mouth.
E.
that.
coli.
I mean, if you
There's
eat something
traces of-
if you eat something with too much E. coli in it, food out in the street, you're gonna get sick, right?
Yeah.
Yes.
So
Same
But
thing.
it is a big craze.
But what if
of
you have a
people doing
fresh bath first?
that. You always in the bath.
Wait a minute.
You're always.
Oh my gosh.
What if is the E. coli just there all the time?
Yes.
Really? Even if you have a good wash?
yeah.
Even if you have a washalette.
Well,
or
most
what's
people
that
are
called?
clean.
Bidet,
Most people
all of
taking
that.
a bath, right?
Yes.
So it's still there.
The doctor said. No.
She said,
You brought it up. I'm just
Cut it out,
asking
y'all.
some follow-up questions.
The doctor
Where's that
said,
for me?
knock it off.
Well, what about just normal oral sex? That's okay, right? Because there is the saliva issue with
But that's what I was
the contact with the
asking about the
vagina.
saliva.
Is
Yeah,
that
I mean,
still
I don't
an
think
issue,
it's
or
really
you just
referring to.
brush your teeth beforehand? I don't know. Wash your mouth out. That's a serious question.
It is. That's what I was wondering about the saliva for the dryness. Would that help? That's what I was wondering.
No. Because that's not lubrication.
She gave you Crisco and no It's getting hot in here.
It feels like
I would like to turn the air back on.
Crisco and vaginal estrogen. That's
it.
what we know.
That's
And
a
that's
great-
not even-
That's your option.
That's really cool though, Crisco.
She
right.
said that's
It
your
was just she
That's
went
really
and she
fun
looked
to
because she
say.
wanted to know why this was working for this lady, and we were like, oh wow,
It's
okay, soy based.
You heard
And
it
it's not
here.
like but if somebody told me they could not afford the estrace, I would, it's not like I tell people, oh, use Crisco.
Yeah.
Is
You know,
it
but-
covered by insurance?
Yeah, and that price could still be $100.
That could still be your copay.
Yeah, yeah, we need to check
I'm
these
having a hot
pharmaceutical
flash.
companies.
I know
But,
it's so ridiculous. It's so ridiculous.
I mean, we think it's medicine, right? But really, the pharmaceuticals are.
Of course.
Right.
That's who's really making a lot of money. Yeah.
Well, thank you so much for joining us.
Thank
This was
you.
a lot of fun.
Yeah.
Great information. Please
You're
come back again.
welcome.
No spit.
Plenty of
Thank
questions.
you. No saliva.
No more.
Okay.
No more.
I'm not guilty.
Saliva. No bottom feeders. Is that what?
No bottom feeders. That's a perfect ending.
No eating booties like groceries. That's a line too. That's a line too.
Yeah.
That's what started the
That's what
craze.
started.
Those rap songs.
Right. Talk about eat your booty like groceries. Then you have people who are curious. Like, really? Like groceries?
Yeah.
Like,
Yeah.
Just the whole.
Then the girl
like,
takes
booty
the most
phase.
innocent little boy on
Yeah.
the block and asks him to do it, and then
Yeah.
MG.
Yeah. You heard it here.
Tell your sons no.
No.
Thanks for listening,
Just
guys.
say no.
Bye.
Thanks for listening. You can follow us on Instagram at 3_MAMA.s. And you can also write to us at middleagedmamas@gmail.com for any comments or questions you might have.